guys, Dr. Sammy here, and this is my old girl. She's been around for about 13 years with me. She's getting old. She's got old dog problems. She has IVDD, so intervertebral disc disease. She has it a little bit bad in her cervical spine. She has pretty bad arthritis in her elbows and her hips. Not too bad in her knees. As she's gotten older, she's developed kidney disease as well. And, you know, for a 13-year-old lady who's doing lots of different things, she's doing pretty good. Oh, sweetheart. I know. You're nervous about being on the table. You're not used to tables. No. See, oh no. I'm not used to tables, no. So, Taylor, we got her as a rescue a long time ago. She was a parvo survivor. Back then, my dad was kind of messing with her, and her heart had actually stopped on 2 to 3 separate occasions, and they brought her back through CPR and some other emergency drugs. And ultimately, she was surrendered and got her through parvo, and here she is, 13 years later, doing good. She had terrible genetics. Her hips at the age of 2 were terrible. She looked like a 15-year-old with hips. They were bad enough to where we had to put her on joint supplements and different medications very early in life. Eventually, as she got a little bit older, I think when she was 10, so about 3 years ago, we did what's called an FHO on her. So what that means is you have the hip and you have the sockets with the head of the femur, and she had such bad arthritis that we actually cut the head of that femur off to get rid of the source of the pain from the bone-on-bone contact because her arthritis was so bad. And I made the judgment call to do that when she was 10 instead of 13. I'm glad I did. Worked out really, really well for her, and once she got through the recovery, she was very, very happy and running, jumping, and playing again like when she was a 5-year-old. So that was exciting and fun to see. For the most part, she's done pretty good. We've kept her on the JD diets from Hills, basically a joint diet, some Dasequin, when needed, different vetprofens and different pain medications. And overall, she's done pretty good. But this is my old girl. So for those of you that deal with arthritis, which are most geriatric patients, anybody who's over 7 to 8 for a dog is considered a geriatric patient. And for your feline owners out there, North Carolina, I believe it was in 2018, maybe 2019, had a study where they looked at over 140 cats. They were all fairly young, as in around 3 years, maybe a little bit less, or right in that ballpark. And they found 90% of those patients had some degree of arthritis, whether it was in the elbows, hips, or the knees. Now, only a small percentage of those patients were clinical, but they did find arthritis in a high percentage of feline patients at a very young age. And that was very shocking, but that's what North Carolina found at their vet school here in the not too far past, huh, sweetie? Alright guys, well hopefully that gives you guys a little bit of encouragement for those of you that have arthritis for your fur babies as they're getting a little bit older. So take care guys, and we'll see y'all later. I'm Taylor.